Hi everyone. Today's video I would like to talk about breathing. Why breathing, you ask? It's so natural, involuntary, you don't think about it. Well, maybe it's time you do think about it and how it can help even with any kind of pain that's happening through your neck, maybe through your mid back, lower back, even abdominal region, hip flexor region. So, um, what I like to say is breathing really helps set a great overall foundation, helping with development of your whole body. It helps to stimulate the parasympathetic nervous system, which is the rest, digest, anti-stress, nice big breath. And then there's different types of breathing, or the other type of breathing is stimulating the sympathetic nervous system, which is more fight or flight response and more that causing of anxiety, that stress. So, what I would like to talk to you about is 3 different ways of breathing. So we have chest breathers, we have abdominal breathers, and we also have breathing with throughout the rib cage. So, starting with our chest breathers, generally with chest breathing, you might or tend to see a little bit more increase in neck tightness, shoulder tightness, maybe even causing roundness of shoulders or contributing to it. Of course, that alone is not good, causing maybe hand numbing if you're getting any pinching of the nerves. So really breathing alone right there, I can tell you, will help you even with posture. If you are a chest breather, you will see more tightness through the neck and chest, being those accessory muscles to help breathe and bring the air in. Where it should be the diaphragm, so there's like this muscle right here that pulls down and expands the lungs. It still will be working, but maybe not to its full function to help you breathe. So there's that one, the chest breathers. So being aware of that. We also have our belly breathers. So it is great to breathe in through your belly, distend the belly, and then relax. However, if you have any kind of loose fascia happening here, maybe say for example if you were pregnant, maybe a little bit overweight, and you're able to bring that air in, really distend the belly out, push it out as you breathe in. Maybe belly breathing's not the best option, and I will get to that for the reasoning why. So belly breathing, of course, does help stimulate the parasympathetic nervous system, getting that anterior distension, but maybe, again, not really good if you are really loose in this area, causing more stretch in that fascia and more distension in that belly. If you have a very tight abdominal cavity, you have a really hard time taking a deep breath in, distending that belly out. Maybe that is a good place for you to start, just trying to bring the air in to that belly for some belly breath. So the other type of breathing that I would really like to hone in on you today is ribcage breathing. So what that is you're to take a deep breath in. So actually, let's just do this together. I want you to place your hands around your rib cage. So you have the backside, your thumbs along the backside. And I want you to just take in a normal breath. So you're just breathing in and just see how that feels. Are you getting any distension in the rib cage, any expansion? Or is that air all coming down into the abdominal region? Or is it maybe just staying up in this chest area? So what I want to talk about is trying to get more of a lateral distension through the rib cage. So if I use my dummy guy here, when you do take a breath in, you do want the rib cage to move. So you do want to see the rib cage is expand in the front and a little bit in the back. You don't want just all that breath coming in and getting this belly breath. You do, again, want to see the rib cage move. So why? So we have, I turn this guy around, we have all these joints back here where our ribs attach to our spine. And with all those joints, kind of like almost all joints in the body, you do still want a little bit of movement and not where they're so stuck and adhesive together. Yeah, so you want some movement through there as well. Sometimes, if you are belly breather, chest breather, you won't get that distension of the chest, which is what you really want to really help get the mobility through those joints along the spine and rib cage attachments. So, one way that we can do this is just like I showed you earlier, is placing your hand around your rib cage, and really you can push in just a little bit for a little added resistance, and really try to expand the ribs as you're breathing in. And then just as you breathe out, just let it come out involuntary, like very passively. So you're gonna, again, breathe in, try to get as much movement through the rib cage as much as you can. And when you do breathe in, try to pay attention to where the ribs are expanding. Like if ribs are more expanding anteriorly, you'll feel more pressure here. You really want to try to focus on getting that expansion through this area, more pressure through here when you're holding your ribs as such. So getting that, again, nice rib expansion really help to increase mobility through those joints, really will help to decrease any tension, maybe help with low back pain, mid back pain, as well as even up through your neck. So those you guys who are chest breathers, really nice or really tight neck muscles, chest, maybe around his shoulders, really try to bring that air in to those areas that are harder to breathe. So what I mean by that is air travels through our canal and it'll go to areas of lowest resistance. So if you're getting a lot of distension here, so your fascia is really loose right here, and you're getting a lot of distension, it's really easy for you to breathe into that area. But maybe right here it's a little bit sticky, maybe even through the back it's maybe a little bit sticky, you're getting a little bit of mid-back pain. So really try again to expand the rib cage out more laterally. Now, the other cue that I like to use, or for individuals who have a hard time and maybe don't have that mobility in their shoulders or wrist elbows that can't do this to get that external cue, what I like to say is either grab a belt, or I have this yoga strap, or even just a long towel to roll it up. You're going to take it, wrap it around yourself, just so it's like a little snug. Don't go so hard. A little bit snug, and hold it there. And then try to breathe into that rib cage again. Again, this area here, you're causing a little bit of resistance, so the air doesn't want to go in this region, but really focus on pressing the rib cage out along that belt. So hopefully even just starting with that will help to increase mobility through the spine, decrease any stress, tension through the neck, the shoulders, or any neck tension or any tension through the spine, maybe even hip flexors. So breathing is really a great foundation it's really good foundation as just for your body as a whole. It can help even with increase in exercise gains, working with your breath as you're doing exercise. So for example, when you are exerting yourself, you're breathing out, and then as you're kind of going into that more eccentric contraction, that little, not quite relaxation, but that controlled phase, then you're going to breathe in. So what I mean, just for a quick example, if I was to do a row where I'm squeezing the shoulder blades together and then relaxing and squeezing, and a little more, not relaxing, just that eccentric contraction, it's breathing out and then breathing in. So if you can even tie your breath into your exercise program, that will also help to gain, it would help with your gains, as well as decreasing that tension, that holding of your breath, causing your neck to flare up or get stiff. So I hope that helps. Give that a try, especially for those, again, who are chest breathers, abdominal breathers. Really try to expand the rib cage. Nice movement through the ribs to help with the mobility in the joints where the ribs attach to the spine in the back. So give that a try. Maybe even if you start with little resistance or little repetitions. For some people, maybe for who are chest breathers, might tend to practice this and get lightheaded very easy. So make sure you stay within your limits. Of course, ask your doctor or physician if this exercise or activity is right for you. Other than that, I hope you enjoyed this video, and I hope that, happy breathing, everybody.